You lean in for a cuddle, your cat opens her mouth, and suddenly that sweet little face hits you with a smell so bad you pull back in shock. Not just fishy food breath, not just morning mouth. I mean rotten, sour, metallic, or strangely chemical. The kind of smell that makes you wonder how something so small can produce something so awful. If that has happened in your house, I want you to know something important right away. Bad breath in cats is not normal. I am Dr. Susan, your neighborhood vet, and when a cat's breath smells bad, I do not brush it off as one of those quirky cat things. I treat it like a warning sign, because in many cats, that odor is the first clue that something painful or medically serious is happening. A lot of loving owners wait too long on this one because cats are masters at looking fine while quietly suffering. They still jump on the sofa, they still purr, they still come running when the food opens. Meanwhile, under the gumline, there can be inflammation, infection, loose teeth, and real pain. Or the smell may not be coming from the mouth alone at all. Certain breath odors can point us toward kidney disease, diabetes, severe mouth ulcers, or even a dangerous infection that needs urgent care. So today I want to walk you through what different smells can mean, why the common advice you hear so often fails, the simple 10-second home mouth check every cat owner should know, what actually prevents this problem, and when bad breath crosses the line from concerning to emergency. Let's start with the most common reason by far. If your cat's breath smells rotten, foul, swampy, or like something decaying, dental disease shoots to the top of my list. This is incredibly common. By age 3, roughly 80% of cats have some form of dental disease. That number surprises people every single day in practice because many of those cats still seem to eat. Owners often think, she cannot have tooth pain, she finished breakfast. But cats often keep eating despite significant pain. They may chew on one side, swallow kibble with less chewing, prefer smaller bites, or simply tolerate discomfort because survival tells them to keep eating. What is actually happening in the mouth? Plaque forms on the teeth. That soft film hardens into tartar. Bacteria and the body's inflammatory response irritate the gums, causing gingivitis. As things progress, the trouble moves deeper below the gum line, where you cannot see it just by lifting the lip. The ligament and bone that support the teeth become damaged. Pockets form. Infection settles in. Teeth loosen. Some cats develop tooth resorption, where the tooth structure is literally broken down and becomes extremely painful. Others develop stomatitis, a severe inflammatory condition that can make the whole mouth feel raw. This is why breath odor matters. It is not just a smell problem. It is often a pain problem. And here is the piece owners miss most often. The worst disease is frequently hidden. You may see only a thin yellow line on the tooth or a little redness along the gums, while below that line the damage is much more extensive. In the clinic, we diagnose this properly with a full oral exam. And for many cats, that means an anesthetized dental procedure with dental x-rays, because the part we need to evaluate best is often under the gum line and in the roots. A cat can have a mouth that looks only mildly messy on the surface and still have teeth that badly need treatment. Now let's talk about a different type of odor, because not all bad breath smells the same. If the breath smells sweet, fruity, or oddly like nail polish remover, that can be a red flag for diabetes, especially if you are also seeing increased thirst, larger clumps in the litter box, weight loss, or lethargy. When the body cannot use glucose properly, ketones may build up, and that can change the smell of the breath. In a cat who is weak, vomiting, breathing oddly, or seems very unwell, fruity breath can be an emergency because diabetic ketoacidosis is life-threatening. If the breath smells like ammonia, urine, or a harsh chemical odor, I worry about kidney disease. Cats with kidney problems can develop a very characteristic uremic smell to the breath. They may also have mouth ulcers, nausea, poor appetite, weight loss, dehydration, or increased drinking and urination. Kidney disease is common in older cats, and sometimes the owner notices the breath before anything else. Again, this is why I never dismiss halitosis as cosmetic. A metallic or bloody smell can happen with advanced gum disease, oral ulcers, trauma, a mouth mass, or an object stuck in the mouth. A sour smell can come with severe dental infection, nausea, or oral inflammation. And if your cat has sudden extreme drooling, a foul odor, and pain after chewing on something caustic, swallowing a string, or biting an electrical cord, that is not watch and wait territory. That is urgent. So why do common fixes fail? First, because most people are trying to freshen odor instead of treating the source. Breath sprays, water additives of uncertain benefit, flavored gels that do not involve real mechanical cleaning, and the classic assumption that dry food will scrape everything clean all sound appealing because they are easy. But the mouth does not work that way. Let me lovingly retire one of the biggest myths in feline dental care. Crunchy food does not clean teeth in the way most people imagine. Most kibble shatters the second the tooth hits it. It does not act like a little toothbrush polishing every surface. If dry food truly cleaned teeth well, 80% of cats would not have dental disease by age 3. Standard crunchy food may be fine nutritionally when chosen appropriately, but it is not a reliable dental cleaning plan. There are dental diets that can help, and this is where the details matter. Some specially designed dental diets have a texture and fiber matrix that encourage the tooth to penetrate the kibble before it breaks, creating more of a wiping action. Those can be useful, especially if they have Veterinary Oral Health Council approval. That approval matters because it means the product has met standards for reducing plaque or tartar. But even then, they are helpers, not magic. They do not replace brushing or professional care when disease is already present. Another reason common fixes fail is that they target what you can see, while the real trouble is often below the gum line. You can wipe the visible tooth surface and still miss periodontal disease hiding under inflamed gums. You can cover odor briefly and leave infection untouched. And once a cat has established dental disease, prevention alone is no longer the answer. At that point, we need diagnosis and treatment. So, what is the real fix? It starts with recognizing that bad breath is information. Then it moves into 3 levels of care: home monitoring, daily prevention, and professional veterinary treatment when needed. First, home monitoring. I want every cat owner to know the 10-second mouth check. This is not a wrestling match. This is not prying the jaws open. Pick a calm moment when your cat is relaxed. Gently lift the lip on one side, then the other. You are looking for 4 things: the smell, the gum color, visible buildup, and signs of pain. Healthy gums should generally look pink, though pigmentation can vary in some cats. What you do not want is a red line where the gum meets the tooth, swollen tissue, bleeding, brown or yellow crusty buildup, broken teeth, ulcers, or a cat that jerks away sharply as if the area hurts. If opening the lip reveals a terrible odor, heavy tartar, drooling, or obvious inflammation, your next step is not a mint. It is a vet appointment. Second, daily prevention. The gold standard is toothbrushing. I know some of you just sighed. Stay with me, because done properly, this is far more realistic than people think. The goal is not a deep scrub of every surface inside the mouth. The goal is regular cleaning of the outer tooth surfaces near the gumline, where plaque begins. Use a pet-specific toothpaste only, never human toothpaste, because ingredients like fluoride and xylitol are not safe choices for cats to swallow. Start slowly. Let the cat lick a tiny dab of pet toothpaste from your finger. On another day, touch the lips and cheeks gently. Then introduce a finger brush or soft pet toothbrush. Eventually, work up to a few gentle strokes along the outer surfaces of the canine teeth and back teeth. Short sessions win. Praise wins. Consistency wins. Even a few times a week is better than nothing, though daily is the ideal. Now a very important caveat. If your cat already has painful dental disease, brushing can be miserable or even unfair until the mouth has been treated. If the gums are inflamed, the cat cries out, there is bleeding, or the odor is severe, I do not want you forcing brushing in the name of prevention. Painful mouths need diagnosis first. The third level is professional care. If your cat has established dental disease, the real fix is a proper veterinary dental procedure. That typically includes anesthesia, a full oral exam, ultrasonic scaling above and below the gum line, polishing, probing, and dental X-rays. If diseased teeth are found, they may need extraction. Owners often worry that extraction sounds drastic, but when a tooth is diseased and painful, leaving it in place is usually far worse than removing it. Cats often feel dramatically better once a painful tooth is gone. They eat more comfortably, groom better, and become brighter in ways families did not realize had faded. Let me pause here for an anesthesia reassurance, because I know many cat owners, especially with older cats, get nervous at the word dental cleaning under anesthesia. That concern is completely understandable. The reason anesthesia is used is because thorough cleaning below the gum line, accurate probing, and dental X-rays cannot be done safely or humanely in an awake cat. A good veterinary team reduces risk by examining your cat first, recommending appropriate pre-anesthetic testing, tailoring medications, monitoring vital signs closely, and using modern protocols. There is always some risk with anesthesia, but there is also risk in leaving infection and pain untreated. For many cats, the benefit is substantial. So how do you know whether this is a routine appointment issue or an emergency? If the breath is simply foul, but your cat is otherwise acting fairly normal, book an appointment soon. Not months from now, soon. Within days to a couple of weeks, depending on severity and availability. If the odor is severe and accompanied by drooling, pawing at the mouth, trouble eating, visible swelling, bleeding, weight loss, or obvious pain, I want that moved up. If the breath is fruity and your cat is weak, vomiting, breathing deeply or rapidly, not eating, or acting collapsed, that is urgent. If the breath smells like ammonia and your cat is lethargic, not eating, vomiting, or seems dehydrated, that is urgent too. If there is sudden swelling under the eye, facial swelling, open mouth breathing, inability to close the mouth, suspected toxin exposure, electrical cord injury, or major trauma, seek emergency care. There is also a subtle but important category I do not want overlooked. Cats with mouth pain do not always drool dramatically or cry. Sometimes they simply become picky. They approach food and walk away. They chew slower. They stop grooming the back half of the body. They seem less social. They hide more. Owners may tell me, she is just getting older. Then we treat the mouth, and suddenly the cat acts years younger. Pain steals vitality quietly. Let me give you a short owner story that I think captures this perfectly. A client brought in a 9-year-old tabby named Oliver because his breath had become unbearable. She apologized when she said it, as if she had somehow failed him. She told me he still ate every meal, so she thought maybe it was just his food. But lately he had stopped grooming his chest well, and he had started dropping pieces of kibble. On exam, the gums looked angry, and once we did his dental procedure with x-rays, we found advanced periodontal disease and several painful resorptive lesions. He needed multiple extractions. His owner was worried he would never manage without those teeth. 2 weeks later, she called and laughed through tears because Oliver was playing again, grooming again, and begging for dinner with more enthusiasm than he had shown in years. She had thought the bad breath was the problem. It turned out the bad breath was the clue. Now, let's knock down a few myths, because these keep cats from getting help. Myth number 1 is that bad breath is normal in cats because they eat fish or canned food. No. Food can leave a temporary smell right after a meal, but persistent offensive breath is not normal. If the odor lingers, there is a reason. Myth number 2 is that if a cat is eating, the teeth must be fine. Also no. Cats are remarkably stoic. Many continue eating despite severe dental pain. Eating is not proof of comfort. Myth number 3 is that a professional dental cleaning is only cosmetic. Absolutely not. In veterinary medicine, a true dental procedure is about health, pain relief, infection control, and preserving function. It is not a spa treatment for teeth. Myth number 4 is that old cats are too old for dental care. Age by itself is not a disease and does not automatically rule out treatment. What matters is the individual cat's overall health, exam findings, lab work, and anesthetic plan. I have seen many older cats benefit tremendously from dental treatment that gave them a more comfortable and happier life. There is one more myth tucked inside the crunchy food conversation that deserves its own sentence. People sometimes say, "My cat chews hard treats, so his teeth are getting cleaned." Unfortunately, many treats add calories without delivering meaningful dental benefit. If you want a product to help the mouth, look for VOHC-accepted dental products. That council's seal is one of the easiest ways for owners to separate marketing from evidence. You may be wondering what to do if your cat absolutely refuses brushing. First, do not give up on the whole idea after one bad attempt. Most cats need gradual desensitization, not surprise scrubbing. Second, ask your veterinarian which VOHC-accepted diets, treats, or additives may fit your cat's case. Those can be useful support tools. Third, remember that a cat who resists mouth handling intensely may be telling you something. Sometimes the refusal is not stubbornness, it is pain. A quick word on kittens and young cats, because this problem is not only for seniors. Young cats can have bad breath from retained baby teeth, congenital bite issues, early gingivitis, ulcers, infection, or even something as simple as a foreign object caught in the mouth. So, while kidney disease becomes more likely with age, foul breath at any age deserves attention. Never tell yourself, "He is too young for dental trouble." I have seen significant oral pain in very young cats. I also want to touch briefly on the whole body effects, because on-mouth is not isolated from the rest of your cat. Chronic oral inflammation and infection create stress and discomfort that can affect appetite, grooming, and quality of life. In some species, periodontal disease has been associated with broader health concerns. In cats, the most immediate and proven issue is pain, and pain alone is enough reason to act. We do not need to wait for a catastrophe to justify caring for the mouth. So if you are sitting there thinking, "I noticed this smell a while ago and hoped it would pass," please let this be your gentle nudge. You are not overreacting by getting it checked. You are being observant. The earlier we catch dental disease, the better chance we have to manage it before it becomes more advanced and more painful. And if the smell is not dental, that exam may uncover a systemic illness while there is still valuable time to help. Here is your one-breath recap. Bad cat breath is not normal. Rotten breath usually points toward dental disease that is painful and often hidden under the gumline. Sweet or fruity breath can warn of diabetes. Ammonia breath can warn of kidney disease. Crunchy food does not reliably clean teeth. The 10-second lip lift at home can catch odor, redness, tartar, and pain. The real prevention is brushing, plus VOHC-supported products and regular veterinary care. And severe odor with drooling, weakness, vomiting, trouble eating, swelling, or odd breathing needs urgent attention. If you want more clear, practical cat health guidance without the scare tactics, subscribe to Dr. Cat, because I want to help you catch the quiet warning signs before they turn into big problems. Until next time, give your cat a gentle lip lift,